Hi, everyone. We are going to go ahead and get started in just a couple of minutes. We're going to wait for a few more people to log on. All right. Hi, everyone. My name is Caroline Horn. I'm the Associate Director for Orientation and Student Onboarding here at Bentley. We are so excited to have you all here today to learn a little bit more about what student well-being looks like at Bentley. This live chat is you are able to see us. We are not able to see you, but if you do have any questions throughout the entire session, feel free to use the Q&A feature, and we'll be answering those questions throughout the presentation as well as at the end. This session is recorded, so we will put this onto our YouTube channel for you to review after the session. If you are watching the recording and you have any questions, feel free to ask those questions through our new Falcon question form, and we can get those answers over to you. And now I'm going to kick it over to Julia Matthews to kick off the session.
Thanks, Caroline. Hello, everyone. Thanks for joining us today for this live chat. We're in sunny Waltham and excited to talk with you today about the resources that are available to your students. My name is Julia Matthews, and I'm the director at the Health Center.
Hey, everybody. My name is Peter Faulkner. Welcome to our session today, and I am the director of the Counseling Center here at Bentley.
Hello, everybody. We're excited to be with you this afternoon to talk about student well-being. My name is Jessica Greer-Trava. I'm the Director for Community Wellbeing and Health Promotion. So we wanted to just start off by talking a little bit about our work together. We are three different departments that really focus on student well-being from a holistic perspective. We're committed to the provision of high-quality, inclusive, evidence-based care that supports the identities, beliefs, and experiences of all of our students on campus. And we do this through the provision of direct clinical and psychological services, prevention-focused initiatives, our infrastructure and capacity building, supporting of student resilience, and the creation of foundation for balance for ethical decision-making and social accountability. All that's to say, we work really closely and carefully to make sure that your students have what they need while they're here on campus to support their physical, emotional, and social well-being. So inclusion and quality improvement are continuous. It's also something that's based in the workflow of our offices. We do participate in annual racial and social justice development, professional development opportunities, as well as continuous goal setting in these areas. We're trained in trauma-informed care, allyship, and participate in continuing education. We advocate for services and resources to ensure that we're meeting our student needs. We have a strong network of referral resources that reflect the identities of our community members. We really focus on our policies, programs, and procedures to make sure that they're updated and reviewed annually. And our services and spaces are regularly assessed by our student body, as well as other external reviews to ensure that our students are feeling supported, welcome, seen, valued, and heard. So just wanted to give a little bit of the context of the care that we put into the work here, and I'm going to turn it over to Julia now to talk to you about the Health Center and the services for our students out of our Health Center space.
Thanks so much, Jessica. Just to say on a personal note, college health has become front and center for many years that I've been at Bentley, 8 years now. But now that I have a rising senior, it's become personal. I have been on a number of college tours, so I am right there with you with all the excitement and pride that you have in your students who are heading off, and also some of the anxiety. So I hope today's information session with Jessica and Peter and I really will demonstrate how many resources are available on your campus and how excited we are to have your student here and connect them with anything that will be helpful to them. So that's really the message we want to get across, that we're here. There's our phone number, our websites, our emails are all available, and summer's a great time to connect too. If there's any things that top of mind for you that you have concerns that could make it easier for you to get to campus on that move-in day and feel comfortable and have your student feel comfortable. So we'll go over the resources that are here. I have that video, Jessica. I don't know that I realize that may not be easy to put up, but there is a lovely 1-minute video that gives us a chance to take a look at the health center. And if it doesn't work, that's okay. I should have given you a heads up. But in the meantime, I'll just tell you that the health center, oh, maybe it'll work. We are, oh, will that work? That'd be awesome because it goes through, but the sound may not come out. That's okay. So this gives a nice tour of the health center, and we are available Monday through Friday. And this is our nice reception area. Students check in right here. They scan a QR code. They answer a few questions about why they're here. They get to see a nurse practitioner. Clinic rooms are very similar to what you might see at your own provider's office or urgent care. We provide prescriptions and can get them delivered to campus. We have vaccine clinics in every fall for flu, COVID, and other routine immunizations. And we have access to contraceptive supplies. And we do an express STI clinic. And this is really just a quick view of what you would see in the health center. And now I'll just take a few more moments to tell you in a little bit more detail. So we're available for all full-time students, regardless of insurance. When students come to the health center, there isn't a copay or a fee for seeing a nurse practitioner. That is included in your registration and tuition fees. If labs are sent or the student is referred to another urgent care or specialist, then that would ask for insurance for those fees. But to come into the health center when your student, who inevitably may wake up with a cold after being on campus in the fall, and they come in and get some advice and care, that is covered by the registration and tuition fees. We also, when we're not open, we're open 8:30 to 4 every day. We have an after-hours nurse advice line that the student can call our usual number and speak to a clinician anytime in the evenings, weekends. And of course, for any urgent concerns or emergencies, University Police, which is a very nice service on our campus, our campus police would transport a student who is in need of urgent care to the local urgent care or emergency room, depending on what's happening. So in addition to nurse practitioners, we also have a student health specialist who helps students get their health requirements completed. We have a nutrition and wellness coach for students who are interested in talking about fitness or chronic disease, or just want to discuss health goals. We also have a sexual assault resource specialist that gives guidance and support to students in response to sexual assault. And she also does a ton of trainings on campus for staff and faculty and students. And the clinician consultant who works with us does a lot of excellent education for our staff. So essentially, what can your student be seen here? Basically, we treat many common health conditions. And we also, so if a student is coming in for a cold or a skin issue or a hurt ankle, those are all things we can manage. And as I said, we can also refer as needed to specialty care. If we thought your student needed an x-ray for that ankle or needed to see a specialist because their sinus infection isn't getting better, those are all things that we can get your student connected to care for that. We also provide gender affirming care. We have an express STI clinic, meaning that it's just a quick visit for students to come in and out. As you saw in the video, we have immunization clinics and also can have prescriptions that are written by our nurse practitioners, getting those delivered to campus. On to the next slide, Jessica. Thank you. In terms of confidentiality, we take this very seriously. So no information is shared with any individual outside of the health center, including staff, faculty, family, or friends if a student is over 18 years of age. So how does that look for parents? If a parent calls to say, hey, my student was seen at the health center, tell me what happened. I would say, hey, I would suggest calling your student and talking to them about it, or give me a moment and I'll call your student to get permission. So we do not share information immediately with a parent who's calling, which is very reassuring to students to know that they can come, have their care, and know that it's not shared with family, faculty, or staff. If a student is seen at the health center and has to miss class, we can give them guidance about, hey, this is the way to do this. Email your faculty, tell them you're not feeling well, let them know that you aren't going to be in class today. So we provide them that support, and any student who has a longer term condition or an illness that could be extensive, then we also connect our student to our academic services office to provide that extra support if faculty need more information about what's happening. But we do that again with not sharing the specific health information. On to the next. So again, I think I've said office visits covered by tuition, confidential. Prescriptions are based on your health insurance and may have a copay associated. Our immunization clinics, we have them on campus, and students just need to bring their health insurance card and can get those covered by your insurance typically, since they're preventive care. And then laboratory tests, also we can do those in the health center, and those would be charged to the student's health insurance. As I mentioned, in terms of after hours care, our hours are 8:30 to 4. Our health center is located right across from the student center, so very central to campus. And these are a couple of the local urgent cares that you can see are close by. So Physician One is very close to us, the Waltham Walk-In, and then Newton Wellesley Hospital. So this is all information if we were to send a student for further care. We provide that information to them. We also try to have a conversation with them that if it makes sense to call their parent right at that time to let them know what's happening. So really try to keep that continuity of care, and then follow up with them directly later in the day or the next day to make sure that they got the care that they needed for whatever their issue was. In terms of student health insurance, we have an excellent plan that's available to all students. Students are required to have health insurance. That doesn't mean that they have to sign up for this health insurance. International students are required to enroll in this plan, but students in the US are not. You do need to enroll by August. You need to actually waive the health insurance by August 6th, or it is automatically charged. In terms of the care that Blue Cross Blue Shield, the access that we have in Massachusetts is excellent. The cost you see there is $2,678 for 12 months. There's no deductible for coverage, for off-campus care, $25 copay, no charge for preventive care visits. Emergency room visits are $100. And we continue to really ask that there is no cost for ambulance transport, because that can be a concern for students. And again, we've been able to obtain that this year. So there's no cost if a student needs to be transported by ambulance. And the copays are listed there. So there's the website there, University Health Plans. There's a lot of excellent information, frequently asked questions. We have a great representative if there are specific questions. And again, you can feel free to contact the health center and we can provide you more information about this. And for students who are not going to purchase the student health insurance provided by Bentley through Blue Cross and Blue Shield, it's really important to let your student know to keep their health insurance card with them or keep a picture of it. You never know when you may need that. That information can also be uploaded to the portal where they're doing their other health requirements. So as for anybody, if you're leaving home, it's good to have your health insurance information with you. And then there is optional insurance, dental and vision, more information at those websites, and also tuition insurance. This is for reimbursement of tuition paid should a student have a medical issue or a psychological issue that would be in their best interest to withdraw from a semester. There are dates as the semester goes on that there is reimbursement from the university, and then there's a certain number of weeks that they would not get reimbursement, but with the tuition insurance, that there would be coverage for that. So more information again at that website, and any questions, again, you're welcome to reach out to us. In terms of immunizations, I know it says that deadline has passed June 15th, but don't stress. As long as you get it done in the next couple of weeks, few weeks, it's fine. No big surprises here. Required immunizations are listed here on the left. And then you can also upload recommended immunizations here. In terms of COVID, we do recommend that students continue to get the most recent available dose, and that will be available at our vaccine clinics in the fall for flu shots, HPV vaccine. All of those are recommended. The way it works, there'll be information on our website when the vaccine clinics are scheduled. Again, we do 4 or 5 throughout the fall, so very easy for students to step in, get that done. And we really do highly recommend the flu shot. Students are living in close quarters, so it is easy for, once your roommate gets the flu, for you to get the flu. And we really find that students who have a flu shot, even though they may get the flu, they won't be down as long with the flu. They won't feel as poorly. And so, you know, many of our students are young and healthy, and they say flu shot, but really think about protecting your semester in terms of still being able to get to class and do well, being able to hang out with your friends that weekend and not be sick. So there's lots of good reasons, and we talk a lot with students about getting that done. Again, the deadline was June 15th. The portal, I think, is the next page, Jessica. Yeah, so this is what the portal looks like. We really try to make this easy for students to walk through, so you can see there's a forms tab, there's an immunization tab, you're uploading that information. And again, you're very welcome to reach out to us if there's any questions or concerns. But we've tried to make this very straightforward, and getting those health requirements done is important so that our campus is safe and healthy, and your student has the best chance of having a very successful and healthy semester as well. Okay, and in terms of other resources here, the new Falcon Experience website, I'm sure you have seen. It's awesome. Shout out to Caroline's team for making it so easy for students to see all the requirements that they need to complete and all the good information that they can get before arriving to campus. It's important to make sure your emergency contact information is up to date. For specific questions around health, you can go to our website here, bentley.edu/health. And then again, kind of just a couple last reminders: encourage your student to seek care at the health center when appropriate, and to access the many resources that we'll continue to talk about more on this webinar today. And again, be knowledgeable about your health insurance, have a copy of the insurance card. As I said, the Blue Cross Blue Shield plan is excellent. So if there's a question for particularly out-of-state families, we highly recommend that plan as well. Okay, so again, here's our information. We're very happy to speak with you over the summer. And as the year goes on, please don't hesitate to reach out. We're looking forward to welcoming your student to Bentley in the fall. Thank you.
I believe it's my turn, but Julia, there are a couple of questions in there that you might be able to take care of real quick.
Great. I am seeing that. How likely is a student to get a same-day appointment if needed? I have found my 2 older kids at different colleges, they can't get in, so they have to go off-site. That's a great question. Thank you so much for asking that. And then I can share the health portal address. I'll put that in the chat in just a moment. So in terms of getting an appointment, typically students, they can call, they can stop in, or they can schedule online on our portal, which I overlook saying that. Very easy to schedule online. As long as a student is reaching out before noon, that's probably a good estimate. They're going to get seen the same day. And what we try to also, what we aim for every day is, even if it's a busy time and all of our health appointments have been used up for the day, every student will get a call back with some guidance or direction. But really, when students wake up in the morning, they don't feel well, they give us a call, they will be seen that day. We have enough staff and enough health appointments for the day. Now, if they wait until 3:30 and ask to be seen, that we may be guiding them to urgent care or doing a quick assessment over the phone, or if they stop in person to say, hey, you really, that throat does not look good. We close in 2 minutes. We aren't able to see you. We're going to have University Police drive you over to urgent care to get seen. But really, if your student isn't feeling well, the sooner they see us, the better. And we do not mind if they come in with the sniffles and we tell them, hey, it's just a cold. It's great to get seen. And we're very lucky that we can get students in same day, most of the time, as long as they call early enough. I hope that answered your question. And I will put the portal address in the chat. Thank you.
Great. Hey, everybody. Again, my name is Peter Forkner, and I have the pleasure of telling you about the Counseling Center here at Bentley. So for those of you who aren't aware, the Counseling Center is a mental health resource available for all students experiencing any level of mental health distress. And I like to say any level of mental health distress, and you'll probably hear me say it a couple of times during this presentation, as I don't ever want a student to think that what they're going through is too small or even too big to be seen at our center. If they are struggling and it's mental health related, which is a very broad term that doesn't have to be a diagnosis. If they're just struggling, they can make an appointment and come in and see us, and we'll be able to help them out. Next page. So our staff is a highly trained expert staff in college mental health. We have 6 licensed psychologists who work in our office, along with 3 doctoral interns and a psychiatric nurse practitioner. So I have not done the math of adding up all the experience, but we have many, many years of people who've dedicated their lives to, or their careers to, college mental health. So I can assure you that whatever your student comes in with, we have seen before, and we can help point them in the right direction. Next, yes. So just to elucidate a little bit in terms of what students typically come in for, it really is a broad range of things. Certainly what we see in the beginning of the year is we see many students who are having challenges adjusting to Bentley. That could be because that they have an underlying mental health condition that's making it more difficult, or it could be just that it's normal to struggle when going into a new place and meeting new people and finding their place here at Bentley. So we see a lot of students with that. We see stress, people who are experiencing anxiety, they're worrying too much. We see some depression or just sadness. We often are helping students with relationship or family concerns. Certainly being away from home is very difficult, and sort of managing the day-to-day of academics here at Bentley and also any sort of relationship issues can be challenging. And just having a space to go to talk with someone who has some expertise in mental health and relationships to sort of bounce ideas off of can be very helpful. Certainly we see students who are struggling with alcohol or drug use, and unfortunately some of those students who experience grief. But this is not an exhaustive list of all the things that we will talk to students about. So I want you just to keep in mind that idea that any level of mental health distress, come to the Counseling Center, make an appointment. So a little bit about our direct services. Often students are curious about what it looks like to come into the Counseling Center. So I always like to describe our first appointment as an initial consultation. I think in some ways that's a lot less intimidating when students know they're not coming in to be analyzed to death by a psychologist, but this is just a consultation appointment for them to sort of share what's going on. We'll ask some questions about their background, their history of mental health issues, their current functioning, any sort of symptoms they might be experiencing. And then we'll have a conversation about what makes sense going forward. For some students, and actually for many students, just coming in that one time, having that conversation with a mental health professional and getting some feedback is all they need. In fact, the the mode number, or the more often than not, students are coming in for just one session. But for those who might benefit from more, we may be referring them to one of the staff in the counseling center for treatment or therapy or ongoing mental health support. Now, that could be just for a few sessions. It could be for a semester. In the counseling center, we have a short-term model in which we sort of really consider what the student's coming in for, and see them for as long as is necessary to get them back on track. Now, I'll go into this in a little bit, but we also have a partnership with a telehealth provider called BetterMind. And so for those students who are looking for more ongoing services, that might be a better option, but I'll talk about that in a minute. I mentioned that we do short-term counseling. So for some students, they want to remain in person. They want to talk to somebody in the privacy of an office, and that's something we're able to accommodate. But for some, it's easier just to connect with remotely. So we also offer remote appointments for those students. As I mentioned, we have a psychiatric nurse practitioner on staff who is able to prescribe medications. But I want to be clear about this. Given the limited hours that we have, we are unable to continue medications for students who are coming in who might already be on a psychiatric medication. So if your student is coming in, they're on an SSRI or some other ADHD medication, unfortunately, that's not something we're able to continue to support them getting those prescriptions, but we are more than happy to help connect them with a provider in the area to continue those things. But I want to encourage any student who is currently on medication to have that conversation with their treatment provider, whether that be psychiatric medication provider or even a therapist, if they're to consider what kind of treatment plans they will have upon the start of school. Often that is something that's overlooked, and even if a student is doing well over the summer, the transition to school can be really stressful, and so it might be a good idea to have that conversation and have plans in place for that should they need support when they transition. So this is a graphic that I really love, and because I feel like it really covers all the services available at the counseling center. You'll find this on our website. In that blue circle in the middle is really a description of what we have in person in our office. So it's on-campus mental health consultations and short-term therapy. So we're able to see those students who are wanting to be seen in person and for a short period of time. And so if it looks appropriate to continue meeting with your student, it could be just that one appointment, or maybe we'd be seeing them biweekly for a short period of time to help them get back on track. That's a QR code, which we try to post this graphic as much as we can over campus, but just going to that QR code will take you to the website where students can make an appointment and learn more about our services. But then we have these additional services or programs, like I would describe them, as available as a part of the counseling center. So as I mentioned earlier, we have a partnership with BetterMind, which is a telehealth provider. So for those students who are interested in meeting with a mental health professional ongoing and really aren't interested in coming into the counseling center, you can go just right to our website as soon as they've matriculated and are on campus. Go to our website and register with BetterMind and start meeting with a provider very quickly after that. And they're able to sort of meet with that person on a weekly basis for as long as they need. It's a great service. Really feel fortunate at Bentley that they're so dedicated to supporting students' mental health that they've made this resource available starting in the past couple of years. So certainly something to look into. You can go to our website to sign up. We also have something called Thriving Campus, which is essentially a search engine for those students who are looking for a provider outside of Bentley. So some students aren't interested in meeting with anybody who's associated with Bentley, and that's quite understandable. Or maybe they're looking for a psychiatric provider ongoing. Well, you can go to bentley.thrivingcampus.com, or you can go to our website to find a link. And it's essentially a search engine which allows you to maybe put in your insurance and what exactly your needs are or your preferences in terms of the demographics of a particular provider, and you can find someone who's available in the area. We're also, the staff in the counseling center can help out with that too, if that's something that you're interested in. I always like to bring up Let's Talk. Again, it's sort of an alternative way to connect with one of our providers. Some students are hesitant to come in and sign our consent form and fill out all the forms that we ask them to fill out for an appointment. If you just want an informal conversation with a provider, we will have posted a schedule where one of our staff is somewhere on campus for a couple hours, and we'll just be sitting around. And if your student is interested in learning more about our services, or maybe just has a quick question that they want to ask one of our psychologists, they would just find out when that psychologist is going to be there. Don't have to make an appointment. Just can sort of knock on the door and say, hey, I have a question. Can I talk to you for a few minutes? And that's another way to get in touch with our providers. And finally, Protocol is our after hours line. So we realize that mental health issues are not constrained to the regular business hours of our office. So for students who are struggling and are looking for some mental health support outside of regular business hours, you can just call our main number, 781-891-2274. And you just follow the prompts. And one of the prompts will say, get connected with our after hours care. And so that's a staff of clinicians who are available and can help students who are in crisis, or just need somebody to talk to. It doesn't have to necessarily be a crisis, but that is available 24/7 on weekends as well. So obviously, if it's an emergency, if a student is really concerned about their safety, we want them to call campus police. But anything short of that, certainly Protocol is well equipped to handle those kinds of issues. Two issues which I believe Julia already sort of touched on, but I think it bears repeating. So the barriers that we often hear about coming in for mental health care at the counseling center, that people are concerned about, okay, it's going to cost too much, and I'm worried that everybody's going to find out. So just to put this to rest, the services at the counseling center are included in the cost of attendance, which means you're not using insurance. You're not going to be paying any sort of out-of-pocket fees or anything like that. It's totally included within the cost of attendance. So that should not be a barrier for your students accessing our services. Secondly, everything is totally confidential. That means that if we don't have an explicit written permission from the student saying it's okay to share that the student's even been to our counseling center, then we're not allowed to share that information. So I, multiple times a semester, will have that uncomfortable conversation with a parent who has clearly just had a conversation with their son or daughter who's had just had an appointment at the counseling center, and they have a few follow-up questions, and they say, oh, yes, Johnny was there earlier today, and I just have a few questions, and I have to cut them off then and say, I'm sorry, I can't confirm or deny if your student's been here at the counseling center. I would encourage you that if you do believe that he has been here, then you need to have him sign a release that would give me permission to have that conversation with you. And all of this is done to ensure that students feel comfortable sharing whatever they need to in order to get the support in what can be a very difficult time. And just to reinforce it, the counseling records are not a part of your university record, so it's not going to be stapled to any sort of transcript or anything like that. It's a separate medical record. Making an appointment. So this is really easy. There are 3 ways to do it. Just like Julia shared for the health center, we have, if you go to our website, you can schedule an initial appointment on just through the portal we have there. It's quite easy. And we found that once we instituted online appointments, our calls went way down. I think students these days are trying to avoid the phone as much as possible. I guess we all are. But it's very easy to make an appointment, whether that be a remote appointment or one in person. You can also call our main number. It's right there, 2274. Our front desk, Linda, the head of our front desk, Linda, she's great. She's extremely friendly and will help the student make an appointment. I will say that we ask that all students make appointments themselves. We don't accept parents or faculty or staff making an appointment for a student. We found that unfortunately, when that happens, the show rate for a student is about 5%. Very few students, if they're not making the appointment themselves, are actually coming in. Finally, you can walk in and make an appointment. Now, I will say, just to answer a question from before, generally you can expect to get an appointment within 24 to 48 hours. I would say especially that first appointment, we prioritize our availability to make sure that we're able to meet with the student right away. If it's an emergency, we will clear the schedule and make sure that student is seen. But I can't always guarantee that somebody's going to be able to be seen the moment they walk in. So the best thing you can do is to call or go online and make an appointment in order to make sure that you're going to show up and someone will be available to meet with you. Regular business hours, 8:30 to 4:30. I already mentioned about after hours. You can call our main number to get connected with protocol or after hours service. And in emergencies, you can always call University Police. And yeah, so here's the contact information. Again, my name is Peter Forkner and my email address is there. If you have any questions, feel free to reach out and I'd be happy to answer them. I have conversations with parents all the time about adjustment and making plans for transition to college, or if a student is struggling, how to sort of navigate that issue and get them the support they need. So don't hesitate to reach out. Are there any questions on the Q&A that I might answer? If the student comes in for counseling, is there a conversation with parents? So if a student comes in and requests an appointment, we'll have an appointment with them, but unless they sign a release giving us permission to speak with a parent, we won't be reaching out to parents. Now, sometimes students want us to speak with a parent, and that's totally fine, and they can sign that release form and give us permission, and we'd be happy to have that conversation if help. Is there a charge fee for sessions? Nope, no charge, no fee for sessions. So that's wonderful. Do we have special resources for homesickness? So I think Jessie can tell that she's nodding her head. We have a lot of different services that throughout different levels of the university. We found that many students are directed to the counseling center when they're struggling with homesickness, and we are absolutely able to help students in that respect. But we found we're going to be encouraging them to get connected with non-confidential resources. I've always, people are probably sick of me hearing me say this, but I found that in terms of curing loneliness, in terms of curing homesickness, I think the least effective thing you can do is to meet with a stranger behind a closed door privately. That might be good for an initial consultation, but what we're going to be trying to do is get that student connected with other resources that are going to get them more integrated into the community. Are there suggestions for the parents to get children ready to leave home and be on their own? Oh boy, I could do a whole nother hour on this. I'm happy to talk with anybody if you have initial concerns about this transition. Sometimes you might have an inkling that your student might have difficulties with transition, and certainly having a conversation about that. I can say what doesn't work is, I guess, what I call crossing your fingers and hoping that it's all going to go well. I think the best thing you can do is to have an open conversation with your child, with your student, about sort of what this is going to be like, the resources they have. Briefly, I'd say one challenge that has evolved over the past decade or so is the extent to which students remain connected to home through texting or through frequent calls. So I would, I don't want to go too far into it because we only have limited time here, but, maybe coming up with a schedule of contacts and making sure that you're not in touch consistently over the day. It might say, okay, let's just talk in the evenings at this time. But anyways, why don't you, if you have any specific questions, feel free to reach out to me. There's my email address, and we can talk find a time to talk about this.
Thanks, Peter, and please continue to put questions in the chat. We'll be answering them, as we're going along. So I'm here to talk about the third area on our campus that really focuses on student well-being. We are located in a brand new office space in one of the residence halls that's on our lower part of campus. So my office is located in Copley North, and there is our website. So biggest thing I want to stress is that success requires balance. Our department's here to help. We're really the non-clinical ambassadors to the health center and the counseling center, and often are conduit to a lot of other resources on campus. But my team does a mix. We do direct health education and skill building with students to help them achieve success academically, as well as habits, building healthy habits for their lifelong as young professionals. We also do a lot of work with our faculty and staff on campus to ensure that the environments are here to support your student well-being. So some of the work that we do is really behind the scenes. And we are making sure that there's access to appropriate health resources while students are here on campus. And Julia's team and Peter's team certainly are big advocates and also drivers of that type of work that happens here. So a little bit about our staff. We're a small team. Our staff have backgrounds in counseling or public health. We also have 2 master's level interns that work with our department over the course of the year. And then we have a set of student leaders who are peer educators. And we have a few different focus areas that I'll go over in a minute when we get to talking about them. So I really want to drive home the importance of why focusing on well-being and why these programs and services exist on campus. Oftentimes our students will say that they're struggling with things, as Peter or Julia suggested, and there's a lot of ways that we build capacity in our students or have resources to build capacity. But what you're seeing here right now on the slide is self-reported data from college students on a national survey called the National College Health Assessment. And these are the most common reported experiences or behaviors that students cited last fall got in the way of their academic success. So that could be that they missed classes, they performed poorly on an exam, or it created some other kind of disruption with their academics. So, certainly we see things here like procrastination, which is often a symptom of students not being able to manage their time well, or they're getting involved in spending their time on too many things and not really setting boundaries around getting their work done in a fashion. What ends up happening then is that creates a vicious cycle of stress, which then might create more resistance to do the work that they need to do. So really want to highlight like time management as one of those skills and developing a system with your student. And if they don't have one, our department, Peter's area, academic services, we're all here to support students in developing these time management skills. But some other things that you'll notice here is there's some mental health experiences that students are reporting, such as depression or anxiety. There's also physical health experiences that students are reporting, things like colds and flu. Julia talked earlier about the importance of getting the flu vaccine and how some people will say, I'm healthy, I don't need it. But here we see, 15% of students nationally were saying, actually, those types of viral illnesses have caused, impact with their academic progression. And then we see things like social experiences, things like their relationships with peers or intimate partners or with family that they say are also causing are impacting their success. So I just wanted to frame this for you as to why we do what we do. So in our area, knowing that we're a small team and knowing what the data shows, we really focus on strengthening students' core. When we think about, the core of our physical body, that's really necessary for us to be functioning in a lot of different areas. So for us, we think of the core as our students' physical well-being, their social well-being, and their mental well-being. So these are really the core areas that you're going to see programming on, such as, illness prevention and self-care for minor illnesses and injuries. Really focusing on developing good sleep habits, substance use and harm reduction around that, fitness, nutrition, sexual health. Those are all things that we kind of grouped together as a focus for physical well-being. With mental well-being, we really look at reducing stigma, increasing help-seeking behavior, growth mindset, resiliency, and providing students with the opportunity to develop kind of their mental muscles. And then around social well-being, we're really focusing on communication, consent, adjustment and transition to college, setting appropriate boundaries, healthy relationships, and prevention around intimate partner violence. So what this really looks like in action is a whole lot of fun. Sometimes we have programs that are more self-guided. Sometimes we have programs that are in person. Sometimes we have formal workshops, as you can see in the bottom right-hand corner. That's a sports team that we worked with on a program the other year. Sometimes we're bringing in animals. We've had alpacas on campus. We've had baby farm animals. We bring in therapy dogs. So sometimes it's really a way of taking a break and giving students a different type of interaction, step aside from some of the stress that academics are creating for them. I want to highlight some programs and resources specifically for new students. On the left-hand side, you'll see two programs in particular. One is called Club Connect, and that's really, I would think of it like a continuation of orientation where students can opt into that program and they are being connected with other students who are looking to just build social relationships on campus. The Club Connect groups are set up with a peer facilitator, and the groups just kind of meet and identify common activities that they're interested in, but it's incentivized. And we also offer some really key programs for them that only Club Connect participants can be invited to. And so, you know, it's really about getting to know other individuals on a deeper level over the course of your first few months here on campus. We've had a lot of high satisfaction responses from students who participated in it. In addition, we have a brand new adjustment and transition guide. This covers things from how to get around Bentley, how to get into Boston and Waltham, how to do your laundry, what to expect that first semester. Somebody had asked a question about homesickness, and really that's mentioned in there, and it's normal, and it talks about different strategies for overcoming homesickness. It talks about different strategies for connecting on campus. It really has information and resources specific to different identity groups. It's about how to learn how to become a college student on this campus. So that's linked online in the new Falcon experience resources. And certainly we can provide a separate link to it if you're interested in looking at that. We also do a lot of pop-up informal table options, so students might find us out and about on campus. We have a whole mental health month in October that helps to get students connected with resources, as well as focusing on individual skill building and stigma reduction. And then one of our signature programs that every single student on this campus receives information about at the start of their spring semester is our annual Good Vibes Challenge. And the Good Vibes Challenge is a self-paced, self-directed program where every week students are sent a different fact sheet with a new skill that supports well-being. And they can choose to engage in it or not. But the reason we send it to every student is so that we know that they've received these resources. So just know that we, you know, some of these programs are opt-in and some of these programs students are going to get information about no matter what. In addition to programming, our staff does provide direct services for students. We do health coaching on things like sleep, stress management, study skills. We also do harm reduction education for alcohol, nicotine, and cannabis use more specifically. And then we also have cessation support services available for students in conjunction with Julia's office. We will say, you know, nicotine use is something that is still, unfortunately, super common with younger students and adolescents. And sometimes nicotine use can really get in the way with things like sleep or cause, you know, some emotional distress just because of the heavy stimulant qualities of it. So we work with students who are really motivated to cut back on their use. This is a brand new space that's opening for students this fall. It's called the Wellness, and it's a lounge space across the hall from our office. This is going to be the home base for a lot of the programming that we do that's workshop focused, as well as informal social connection programming. So somebody asked earlier in the chat, do we have resources specific for homesickness? Our peer educators will be hosting events down here throughout the fall for students who might be feeling homesick. Students can also just drop in and connect with one of our peer educators at any point in time to just say like, hey, like, I'm looking for a resource or I'm struggling with this and I don't know where to go. And our peers are trained to refer students to a variety of different entities on campus. But we're really excited for what this space can offer in terms of both student relaxation, disconnection, as well as social programming for them. And again, a lot of it will be well-being focused. I mentioned the peer education groups. We have 3 different focus areas. We have students who focus on relationship and sexual violence prevention. So they focus on education around consent, healthy relationships, and do a lot of prevention work to make sure that our community is supportive and understanding of the resources. Julia mentioned, one of those resources being in her office as a support for students. We also have well-being educators. Those are more generalists. So those are students who are providing education around sleep, stress management, general self-care, and lower risk substance use. And then our newest team are our community connectors. They run that Club Connect program that I mentioned a few minutes ago and are going to be the ones dedicated to running programming in that new lounge space that I just shared the picture of. So this is just a quote from a student in the Good Vibes Challenge from one of the other seasons, and it just shows that there is some connection to the work that's happening on campus. So just wanted to highlight that. And then I want to close with some reminders and requirements. In addition to some of the health requirements that Julia mentioned, there are a few pre-arrival online learning courses that students are asked to complete during the month of August. One is on harm reduction for substance use. One is on healthy relationships and interpersonal violence prevention. One is on inclusion, belonging, and one is on supporting mental well-being. The details will become available for students on Bentley Connect. And I just want to stress that there's custom pathways in these courses so that, sometimes we get questions around the substance use harm reduction course of students, coming from families where they're abstaining and they feel like that course is not relevant to them. And I just want to stress that the course pathways will tailor to individual students so that a student who chooses to abstain from substance use is going to be getting content that's different from a student who is saying that they choose to drink alcohol, on a more persistent basis. And then in addition, for custom pathways with the relationship-focused course, if we have a student who is a survivor of interpersonal violence, there's a custom pathway for survivors so that it is even more trauma-informed for those individuals. Somebody had asked about what we can do to prepare our students. Here's a few topics for you to consider. One thing is that there's going to be ups and downs during this first semester that your students are here on campus. A lot of media, a lot of experiences that they hear from older students is college is the best time of your life. And we hope that that's true. However, it's not going to be all sunshine and rainbows every single day that they're here. And there's going to experience highs and lows, especially during that transition period when they're experiencing what's likened to culture shock. And so really talking about that and being realistic with your students is going to be helpful for supporting them during that transition. Also focusing on disconnecting from social media and not comparing their experiences to what they're seeing. Adopting a growth mindset. We have a really beautiful campus, encouraging your students to get outdoors as much as possible, especially while that weather is so nice here in Waltham. Encouraging self-advocacy. You now know that our resources and offices exist. If your student comes to you and says that they're struggling with something, please encourage them to reach out to us or come and visit our websites to learn more, rather than you calling and making that appointment for them or seeking that information for them. Really getting them to talk to the clinical providers in Julia's area or Peter's area and taking some ownership, developing autonomy around their health. And then finally, normalizing failure. If you're going to have the talk, please have the talk about healthy substance use patterns. This includes amounts of alcohol, frequency, how quickly people choose to drink, the importance of hydrating, limiting shots or higher consumption of alcohol. If you have any questions about how to frame that conversation, please reach out to me. Our team has conversations with students about this all the time, and we can help give you a few key talking points. Really talk about consent and boundaries, personal space and time, how to ask consent of roommates, of dating partners, what are verbal and nonverbal cues if somebody is giving consent or not. Talking about sexual health and safer sex, access to care, which Julia's team provides comprehensive care for students, as well as access to supplies, positive norms around sex, emphasizing sleep. Our students oftentimes will prioritize other things than sleep, but sleep we know is really important for supporting both their physical well-being and their mental well-being. So how much sleep they need, the quality, aids like earplugs, things that might help them, or a mask to help them when they're living in communal environments, and then plans for managing stress, what it looks like and feels like for them, ways they can de-stress. And if you have questions about the variety of resources available, again, please reach out to us, because we can talk through, a whole host of more resources that we might not have included in today's presentation. So if you're curious about staying in the know of either of our offices, we do have a shared Instagram account. It's Bentley_health. So you can learn about different programs, events. We do some health education content in there as well. Things like the vaccine clinics that Julia mentioned, things like the other resources that Peter mentioned for mental health care, those are all broadcast on there for our students. And then finally, here's our contact information. So recognizing we're short on time, but want to open it up for questions. Really grateful for you being here with us in community today. Ooh, and then here's just a few reminders as we're fielding any questions.
I don't see any other questions, but I think everyone has our contact information there. And again, I always just like to kind of emphasize again, we're convenient. You're never going to find a health, counseling, well-being centers more convenient than on this campus for your students. So to access them, we're confidential, cost is covered by tuition, and very competent, committed providers in all of these areas. So we really encourage you to have your student engage, reach out, prioritize their health. Academics is important, but health is most important. So we always have that conversation with students, and it's been great to talk with everyone today. I don't know if Peter or Jessica have other things to share, or Caroline. Thank you for the opportunity.
Thank you all for taking the time to watch this session today. We do have a few other opportunities for your students to connect with our team this week. We have a virtual social program tomorrow night, so if they're interested, that will take place. It is trivia themed. We also will be doing a Baby Falc Friday on this topic with our students on Friday. So if your students have any questions, they can ask those questions on our Welcome Falcons Instagram. So we are excited to engage with them on this topic this week as well. So really encourage them to follow that account and participate in some of the social programming. But thank you to Julia, Jessica, and Peter for taking the time to present, and we hope you have a great day.